Oh, Alex, did you able to join? I see him here. Can't believe you. Logging
He's
on
there. He's
from
there.
vacation. I was like, should hop on, just make sure everybody's okay.
Thank you for the heads up.
Thank you.
Thank you.
Thanks, Tessie.
Well,
Stephanie's
good
in charge,
morning.
right?
For the moment, I guess. Well, good morning, everyone. Thanks to everyone for getting us to join. It is actually 8:04. And I would say if people can do us a favor, if you are not speaking, if you would do us a favor and please mute your line so we can kind of um, cut down on the feedback that we're having, that would be greatly appreciated. So we are starting the capacity committee meeting this morning. I know I want to thank Sally for sending last week's committee meetings. Also, we'll make sure that they get uploaded to our committee's share file that we have. So with that, oh, you know what? Let's start with roll call. One moment. Give me I'm going to just go through the list of names that I see on here, and that's how we're going to go from it. Let's see, how can I do that? All right, here we go. So we have Jean Thompson. We have Leanne Smith. We have Pete Van Ruckel. We have Sally Boland. Now, there are two phone numbers where I am not sure who is the name. I'm assuming, what is this area? Is it 513? I'm assuming that's Cincinnati, and maybe that's somebody. Who is that on the line?
That's Senator Wilson.
Hi, good morning.
Again.
Good morning, Senator Wilson. And then we have another one. I know it's a 614 number. I think it's a 614 number.
Yep.
Who is that?
This is Joe Russell.
Hey, good morning, Joe.
Russell. Good morning.
Thank you. Because many times, like, anyway, that's who we have. And then I know we have a couple of individuals from the Ohio Department of Aging. I believe Alex he's there, but not there. And I think that is everyone. And I believe Sarah. Sarah? Right, I know. I just wanted to recognize you. Mm-hmm. Okay, so now that we've gotten through, really want to check in if you have not gotten an opportunity to look at the meeting minutes that were taken. They were sent to everyone via email and submitted by Sally. If you could take a few moments to look through the meeting minutes, that would be really great. And if there are any corrections or additions or subtractions, please note that. Okay. Well, I don't think we have any subtractions or additions. Can we have a motion to accept the meeting minutes from last week?
So move. This is Pete.
Thank you. All right. It has been motion to accept the meeting minutes. All those in favor say aye. Thumbs up, something like that. Any opposition? Nays? Okay, the ayes have it. The meetings will be a part of our official record. Next, we will go into our conversation. So basically, when we look at our meeting agenda in general, from where we left off, the last 2 points that we will be discussing today will be discussion point 22 as well as discussion point 23. And so with that, we will start off with discussion point 22, which is assisting unpaid Alzheimer's disease or dementia caregivers. So I know a lot of us have a lot of experience and probably some ideas that we can share with the group. And so I think for just the purpose of this conversation with our group, if people don't mind, I would like to just kind of do a round robin to get everyone's thoughts and opinions, if that is okay with everyone. And so I'm just going to go in the list of how I see people. And so, Jean, you are up.
Okay, I'm off mute now. Sorry. I followed your earlier advice, Representative House and Sunaga. But in any event, I think that kind of is part of what we've talked about in some other ways by making I called it a true front door number for families, caregivers to call to, number one, get directed to where they might get help. I think that's real critical, having something like that and having that number widely dispersed, available at all libraries, available at all senior centers. The children sometimes are older themselves when this happens to parents, etc. But I also think that we need to broadly or create really resources for those people, or at least publish those existing resources, the support programs and networks for people who are caring for people with these issues and problems. I think the biggest thing, and then of course, respite care comes into this, offering, I think a lot of times, we talked about that a little bit in previous discussions. I know, speaking for assisted living, that often, but we have to make a resource available even if people don't have the funds, that families will in fact, they just want to break. So maybe they want to go on a week's vacation with their children or something. I think it would be wonderful if we could make those kinds of opportunities available in an even broader way. I think that's very important for families. I'll stop there.
Thank you so much, Virginia. I appreciate that. I think, in listening to what you indicated as far as that telephone number, having that widely available, could definitely go a long way, and definitely respite care. So thank you for that input. Next, I'm going to go to Pete. You're up. Your thoughts?
Thank you, Representative. And I think I agree with Jean. I would emphasize that I think it would be really beneficial if there could be some kind of a centralized directory or repository for all kinds of information, because I'm even thinking about, in addition to resources like where do I get respite, where do I get, if I need help, even if it's not respite, even if I'm there, but I need help with certain things, how could I get that? But then it's even goes to like training for a person who feels that they need it. Like, okay, how do I really learn to, in the best possible way, interact with the person, and that's effective? Because I think we all know that it's not something that just comes naturally, and that, by virtue of them being my mother or my relative, that I'm going to know the right way to interact with them in order to make it as a positive experience as possible for both parties. So, having a way that all of that information is kind of gathered together, or there's a catalog of it so people could easily find it all, because I think it's kind of dispersed at this point. Not that it doesn't exist, it's just it's not easily accessible, or maybe as easily as it should be. And I think also having some really, I guess, well publicized, like 211 or something, where everybody knows this is how you get access to that. So you're not searching around, and I know last week we talked about, somebody brought up, I think it might have been Bev, I don't remember, brought up the consumer guide. Okay, that's one resource of many. But having a place where you could go and say, okay, are you looking for ratings of facilities? Okay, here's the consumer guide. Are you looking for some self-training where you can learn more about how to interact with people? Are you looking for respite? Having a kind of a central place where everybody could go and then branch out into all of the resources that are there, or maybe some that still need to be developed. That's just very, very clear and very well known and very prominent. And I'll leave it to others to how to make it prominent. I mean, but I just think that's really the crux of it.
Thank you for that, Pete. Really appreciate that. Next, I believe, just a quick clarification. Is Leanne, are you taking the meeting notes, or is it Sally taking the meeting notes?
This is Leanne. I am feverishly taking notes today.
Okay, that's what I thought, and so that's why I skipped your name, because I know it's kind of hard. But we will get back to you. So, Sally,
no problem. That's okay.
Thank you.
Thank you. Yep, thanks.
Okay. So I think that I won't. I think the points already taken from Jean and Pete. I think that those are great points. I think a couple things when I was thinking about this. I think I know that there's been studies done in the past to identify, what are the most needed supports from individuals who are caregiving for people with dementia. So I think it might not be a bad idea to reflect back on the literature to see what those supports and assistance that family caregivers are needing and wanting, because I often think and wonder, how has the pandemic changed, what the needs are for people. I'm not sure how much has changed, but what are the areas where people are maybe feeling more strain, and has the pandemic impacted that? I think it's something that probably wouldn't be a bad thing to look at. I remember the last study I looked at, which I think was done over 10 or 12 years ago, the most common thing that family caregivers wanted was respite. They wanted hands-on respite care, because I know a couple weeks ago, Amelia talked about how the respite care is defined broad, which is great because it can meet people's needs. But that was, I think, something that a lot of caregivers spoke about needing more than anything else. So I think it would be important to just maybe look back and see, because I know that there's been studies done to identify and define what it is that people actually want and need in order to make sure that we're assisting and supporting family caregivers as best as we can, because our resources certainly aren't going to be unlimited. I had put in the home some resources out there. I think there's a lot of interest out there that other states are doing to support caregivers, and not only looking at it from a formalized, I think, what's available through the state, but there's a lot of interesting informal networks. And I think, the variation of services available from one community to the next, from rural areas to urban areas can change pretty significantly. And so, putting together some type of listing of resources, I think would be hugely helpful. So, and I guess the other point is it doesn't seem to me that I think the scientists are trying, and I'm glad they're trying, and they'll continue to try. But we've not had a new treatment in a very long time, and I don't know if there's going to be one breaking through anytime soon. So I think it'll be important as we look at putting some assistance in place is thinking about that. I know there's some good preventative studies, but those are years in the making. And for people who have been diagnosed recently or are starting to exhibit symptoms, there's some treatments out there, but they certainly don't stop the disease. And I'm not sure. I haven't seen anything really coming down the pike anytime soon. So I think to keep in context when we talk about what type of assistance and support is available. But I did list out some resources, that are available at the national level. I think that really identifies some work that's happening in other states that might inform us. And I also think it'd be good for us to kind of look at what, is currently being provided through the state. And I'll stop talking now and put myself back on mute.
No, thank you so much, Sally. That was very helpful. I know as Leanne is taking the notes, she is give her a little time to catch up with all those wonderful ideas that you have shared with us. Now I'm gonna move on to Joe. Joe, if you would like to chime into the conversation. Also, a good morning to Representative Creech to see that he has joined this morning. So Joe, if you can share with us a little bit your ideas on assisting unpaid Alzheimer's disease or dementia caregivers, we would greatly appreciate it.
Yes, thank you, Representative. I really liked the stuff that's already been mentioned. I think that's really good, especially the idea around finding an easy place like a 311 or 211 where people can call and get access to it from the perspective of identifying those who might be in a emergent or crisis situation. I don't mean emergency like they need to go to the hospital, but we've seen a significant increase in what's called pop drops, where a loved one is just so overwhelmed that they drop their loved one off at a emergency room just so they can have a little bit of a break, a little bit of respite. And then the hospital doesn't know this person. They don't know what their ailments are. They do all these battery of tests just only to find out that this person's suffering from some sort of dementia-related disease. And then the loved one shows back up and, kind of it's a reset button. So I think I definitely agree that respite, if I was going to rank all of these things, I would say access to respite, even in an emergency type of situation, is super important. I think that, and I have this family experience myself, is, when you have to take care of someone every single day, day in, day out, without a break, it eventually breaks you. But if we can somehow provide a little bit of assistance, even for those people who may not be searching for it right away, but be in that place where, gosh, I need to get this help now, I think that would be really, really great. And as I mentioned on previous calls, I love the idea of more community resources, such as the cafes or access to an environment where people can get information from other people. There was one time in our state where, if you had a child with Down syndrome, there was no resources available to you. You didn't know where to go. And over time, there's been support groups that have developed, and, for young parents who have a child like that, just hearing that everything that their child is doing and they're going through is completely normal could be the difference between them continuing and put effort in and wanting to give up. So from my perspective, I think giving resources to folks who are on that teetering point of not sure what to do next, I think is really critical. So I'll turn it back to you guys. Thank you.
Yeah, thank you so much, Joe. I think you highlighted the importance that it seems to be coming through in this conversation, specifically around respite care and what can we do to provide the different access points to giving caregivers, unpaid caregivers, that rest, because you know that 24/7 responsibility of giving care to a loved one, to someone close to you, suffering or dealing with and living with Alzheimer and dementia can be very challenging. So thank you for raising that awareness for us. Next, I will bring in Senator Wilson. I'm not sure if you're traveling to Columbus or anything, but I did want to make sure that we provided an opportunity, to possibly even share some of the things that you may be experiencing in your office or in your district, as it relates to just assistance for unpaid caregivers. And then Representative Creech, I'm going to ask that question to you next. So if you would like to prepare, that would be great. So Senator Wilson, you're up.
Well, thank you. I have shortages of things to say at any time. So, when I was convinced to put this bill in that created this group that will result in creating a state plan for Alzheimer's and other dementia, I was convinced of that because they told me of the great explosion of cases that's going to happen in the future. They told me of the problems with the unpaid volunteers and people at home and the need for rest and all those things. And every one of you has alluded to studies. That there's a national study on this and there's a national study on that. And people have gone before us and looked at this from a lot of different angles. There's certainly the money angle, the other state Alzheimer's and other dementia plans. There's all that out there. But that leads me to the question, where's our consultant? In other words, I know we went out with an RFP, and I know that I've been told that we've chosen somebody. We need that consultant in this committee. And we need that consultant because I don't think we've done enough to really look at capacity in the future. I don't think that we have the resources necessary in this unpaid volunteer realm to collect all of the studies that have been done. We're each reinventing the wheel from our perspective of what we see from where we are. But we need to step up a notch. We need to look at what has been done. We need to look at the studies. We need to, from an overall capacity standpoint, we need to know that we're going to need more beds, not less beds. We need to know that we're going to need more help in respite care. And so my thought comes to a question, the Department of Aging, where's our consultant? When are they on board and when they are available to this committee?
Well, thank you so much for that, Senator Wilson. I know the Department of Aging, and we will definitely make sure that we will circle back with our partners at the Ohio Department of Aging to really try to see how we can make that connection and integration for the consultant on participation and supporting of the work of our committee. Next, I see that Representative Creech, he has unmuted himself, so I will let him chime into this conversation. And then I will circle to Leanne, who is taking our notes, and then add a couple 2 cents. So Representative Creech.
Good morning. Yeah, Joe kind of stole my thunder. One of the things that I've been thinking about, and I love the call line, but in our situation, when our family was hit with Alzheimer's, we had a lot of people. I'm in a small community, and we had people, that we could reach out to that we knew had dealt with it. People reached out to us, and a support group, kind of like the grieving spouses groups. It's just good to talk to people that have been in those situations that you're in, even though every situation's different. They're somewhat similar. And I think it would be great to have people helping people. And a lot of times it's just being able to talk about it. Sounds easier than it is, but I think, through senior centers and churches and those kinds of things, if they could come up with one, a time for people just to show up and talk, I think is huge. It was huge for our family. So but I agree with everything that's been said, and how the rubber meets the road is how we got to figure it out. And I agree with Senator Wilson. I think hopefully we can have a consultant guide us in the right path there.
Thank you so much for that. Appreciate that, Representative. Leanne, I don't know if you would like to, take a moment, a little handbrake and add to this conversation, but really wanted to open that up for you.
Yeah, thank you so much. I agree on all points as usual with what everyone has been saying. I think all of the respite care, the support groups, getting the information out there, all of that is very much needed. I have just a couple of other different angles that I thought of. I feel like we also need to somehow look at employers to help the employees whose families are going through this, to enable them to be home with their loved ones. If that's working from home, sometimes that may not be possible if you're caring for someone, but if there's time given, again, just from personal experience, it's hard when you have a loved one at home that needs that care, or you want to give a family member a break, but you're working full time. And it's hard to get away from work to maybe help provide some of that support to loved ones or caregivers or even friends. So I feel like employers need to offer some type of assistance to employees who, and I know you get sick time or you get holidays, but maybe more of kind of some family leave time to help in those situations, and especially in the emergent situations that were referred to. I've been fortunate to have that time, but I also think that just as a consideration that employers could look at. Again, that shortage in the workforce doesn't always make that easy. I understand that, but I think that's one consideration that I had. And then also just, again, just developing some type of tracking system to see how many people are affected, how many people are staying home and caring for loved ones and truly unpaid. I don't know how you capture that number. But, is there any kind of tracking system? And maybe that's part of that 211 number or that 311, that's again been referred to, but some type of tracking system that, to see just how many people are affected, because I bet that number is huge. I bet people would be surprised how many unpaid caregivers are truly out there on a daily basis. So those are kind of just a couple of my thoughts.
Thank you so much for that, Leanne, and especially hearing, as we've been talking directly about the supports that caregivers themselves may need and what we have heard. Thank you for adding to this conversations about the real partnerships we need to have within our business community, because again, as we all know, many caregivers have many more years of work, working hopefully, and if we would like to, have that partnership for them to add to the economy, we definitely have to bring in that conversation with the business community and creating a more supportive environment for caregivers. So thank you for raising that. As I listen to, just to chime in just a bit, I know as Representative Creech was talking about the person-to-person connection, I think, we have a great opportunity to, as we talk about information, but creating those opportunities around person-to-person support groups. I know, because of this technology age, we can, think, oh, somebody could just pick up the phone or go on the internet. But no, I just think, nothing substitutes getting that person-to-person support. And even if we can, as the state is developing kind of our understanding of the full extent that Ohio has unpaid caregivers, finding a way to start getting people who want to be connected together based on geography and place, right? When we have all this information, it's amazing when you get a group of like 25 people who have the same experience, what they can do together, and lean on each other. And I think that's really important. I also have, had the experience of having basically like a care coach that has that I have found very helpful for myself in just literally, when just a variety of things happen, you can have someone who, is trained, that knows a variety of different issues of the experience and the continuum that happens for a caregiver and caring for their loved ones, and having, I would say, just some more resources to reach out and touch someone would greatly, I think, be helpful. And then when we talk about information, really thinking about the many different avenues and how that can be communicated, utilizing social media, utilizing, radio and television, to really just make sure we're getting the message out for wherever, the main resource will be for caregivers, I think will be helpful. So we've had a rich conversation around unpaid caregivers. So now we're going to transition a bit to point number 23.
Pardon me.
Sorry, did anybody have any questions? I'm sorry, go ahead.
Representative House. Sorry, go ahead, Alex.
Oh, thanks,
I think
Sally.
you're going to, I was just going to ask, I was going to actually ask you, Alex, because I think if I remember correctly, there was some items in the SAPA that kind of parallel this. I don't know if that's what you were going to talk about, but I think, just to maybe put that on the minutes too, Leanne, for the consultant to take a look at, because I think there was some good listings, Representative House, to you about talking about the care coaching program. There's an evidence-based care coaching program that was listed in the SAPA to maybe integrate more into communities through Benjamin Rose. But anyways, so that's, I was going to actually ask you, Alex, to talk about that, but maybe you're going to talk about something else. So maybe you can add that to your list, and I'll put myself back on mute.
Sally, you took the words right out of my mouth. If everyone would just indulge me one moment, I wanted to wait until at the very conclusion of the round robin to kind of address a couple thoughts. So I appreciate everyone's indulgence. Yes, the provision that we're reviewing here with item 22 very much aligns with the strategic action plan on aging. So there's certainly an opportunity for us to move in tandem, task force along with the strategic action plan on aging to support caregiver supports. A couple other things as well. Sally, I believe you raised the question about existing state supports. For the purpose of the minutes and for our greater discussion, the Department of Aging does maintain the Alzheimer's and dementia respite line, funded at approximately $2.5 million each fiscal year. Those funds are distributed to our area agencies on aging. A portion of those dollars goes to the Alzheimer's Association so that they can continue to support the work that they do, while the remaining portion of those funds can go to continue to support the Alzheimer's Association, or alternatively to other local partners that the area agencies on aging work with in order to provide those respite services. The last point that I would like to raise is actually with regard to Senator Wilson's questions and comments with regard to the pending vendor, our contractor. The RFP window has closed. DAS, the Department of Administrative Services, is helping us at the Department of Aging to coordinate the furtherance of solidifying a vendor. Those conversations are continuing. We do have a full task force meeting coming up this Monday. So hopefully there will be some additional information to provide. We're very happy, at least at this point, kind of where we are in the process. Things are moving quickly. But hopefully we'll be able to provide some additional details and clarity here very soon.
Thank you so
I'll
much.
remute myself because I was going to ask exactly that question, Alex. So thank you for answering it. Where are we on the consultant?
Well, thank you for providing those updates and the information, Alex. Much appreciated. All right, so now we're going to transition to our second point, discussion point for our committee, which is increasing and improving research on Alzheimer's disease and related dementias. I am oh goodness, I believe it was Sally, if my memory serves me correctly, or that kind of started talking a little bit about kind of the lag in actual research and development, specifically as it relates to the treatment for those with Alzheimer's and dementia. And so I'm going to start from that point, if Sally doesn't mind, for me asking her any ideas on how we can increase and improve research on Alzheimer's disease and related dementia.
Okay. So, it was interesting. So one of the things I do wonder about, and I know that some other states do this, is that some states do allocate funding for research. Certainly, we know at the national level, there's a lot more funding that's available than there was even 10 years ago. So, maybe one of the suggestions is looking at encouraging organizations and research entities to tap into some of those federal dollars. Like I know my organization is involved in their administration for community living grant to look at integrating services into the community for people with dementia who are living alone or who have intellectual or developmental disabilities. But there's various pots of funding, and so maybe through this, and there's 5 of those grants going on right now, 4 or 5. One might have just ended, but I'm only involved in one of them. But these 4 or 5 grants are being involved around the state. So, maybe there's a way to encourage partnerships to tap into federal research dollars, whether that be through universities or other organizations, or, in collaboration with the state to look at furthering research, not only from a drug development standpoint, but better quality of care. It could actually go through a lot of our items, that we've discussed previously, or integrating more services into the community to assist unpaid caregivers like we were just talking about. So that might be an option. And then maybe looking at allocating maybe some of the Alzheimer's respite funds, maybe a portion of it gets used for, research that is done in Ohio. I don't know, doing some R&D with that, or looking at some things like that. There used to be, so I'm going back, and I apologize for that, and Pete may know this, but there used to be a representative from my area, he's since passed, whose wife had Alzheimer's, and there used to be a line item in the state budget for Alzheimer's research. I think it got eliminated like 5 or 7 years ago, but maybe that's something to look at in the future. But certainly I think there's, funding through the National Institute on Aging, HHS, that maybe in a more collaborative effort, organizations and entities and researchers could be partnering to tap into to bring to the state. Because certainly, the consortium I'm involved in, there's some really interesting work going on. And it's not only, like something's going on in rural areas as well as urban areas. There's stuff going on in Cleveland and Akron and Athens, Ohio, and with these pots of grants, and and so that's some thoughts that I have about research. So.
Oh no, thank you, Sally. I think that really has gotten some of our minds going in this direction. I know does anyone else, I know we all have something else to contribute to this conversation, but does anyone would anybody else like to share, or I can continue to do like the Ron Rodden thing? Don't be shy. Don't be shy. Well, Jean, I'm calling on you. What you have any thoughts?
Yes, I do. I really think this is something as a committee we really share with the science committee, and so I think we should try to work closely with them, what they're trying to do. I see research as a big part of as the science committee's bailiwick too. I guess I would say that I think we should press for more national research dollars that are allocated, because I hate us to take, in reference to something that was said, I think it was Sally said earlier, I hate to see us take too much money out of that respite line item so that it can't actually be the hands-on respite that I think Sally mentioned earlier. If it's all into research, etc., then we don't have that thing Sally said, which I actually think needs to be increased, those respite dollars to allow actual physical hands-on respite for people, for unpaid caregivers. But I think we should certainly work on receiving federal funding. Maybe there's even a way with all the CARES Act money that to research the impact of COVID and the pandemic on families and unpaid caregivers and individuals with dementia. I don't know how much, and I'm sure someone else on the call is better able to answer that. I would assume that the Alzheimer's Association is constantly involved in research on Alzheimer's and other dementias, but I don't know that for sure.
Thank you for that question, Jean. I know that's something we definitely can find out as far as, you know, the extent to which the Alzheimer's Association is connected to varying research. So I know we can put that on our to-do list of something to kind of reach out and see, and then also with the collaboration and connection with the science research committee to see how, you know, what ideas or synergy we have in the ideas that we have. So next I'm going to kind of pass the mic over to Pete. If you have any ideas that you would like to add, that would be helpful.
Yeah, thank you. And a couple things popped into my mind. We've talked a lot about respite here, and I think maybe unless it's already been done, and it probably hasn't been done for Ohio, maybe there's some value in researching, looking at it again from a capacity committee standpoint, and looking at what the various capacity related issues are about respite. In other words, number one, what do people want? How much demand is there, would we estimate? And then what services are there out there for that, and what barriers are there to providing it? So I'm just thinking about it, you know, in a very narrow way, like, okay, facility-based respite, where you you take the person to a facility, whether it's assisted living or a skilled facility. What barriers are there out there that prevent more of that being available, more of that kind of respite being available? I know there are some in the skilled nursing world that relate to basically having to treat this person as if they are a long-term patient, even though they're really not. You have to meet a lot of the same or all of the same regulations. That's just an example. I don't want to get into that in any detail, but I think research on what's the picture, what's the full picture of respite would be very helpful, given the importance that we put on it here this morning. And then secondly, I think more broadly, again, thinking about it from a capacity standpoint and going back to some of our previous discussions and meetings along the way, I don't think that we have a full understanding of what all of the resources that are available, and the capacity of those resources. And when I say resources, I'm talking about, you know, care resources. So facilities, community-based providers, home health, you know, all of that. It would be good to have a comprehensive report that really lists everything out and says, okay, you know, we kind of kicked around different numbers. How many dementia units are there really, or memory care units are there really? And no one knows for sure. And obviously there's definitional issues and so forth, but that's, in my mind, I think that would be a very good research topic, and one that you know, fits right within the charge of this committee.
Thank you so much, Pete. Joe, do you have any thoughts when we're talking about?
Yes. So I get I get a little worried when I hear the term research, only because when I think of research, I think of something that's going to take a really long time to complete. And when I think about the work that needs to be done here in the state of Ohio, I feel like there's a lot of work that needs to happen, or that can happen right away, and we don't have a ton of time to kind of work through it. But I do definitely agree with Pete that having some studies done to determine, what we have already in place and what we need can help us maybe fill little holes that exist, rather than, carpeting every part of the state with every resource. For example, if we find out that there's a bigger need for respite in the Cleveland area than in Columbus, then perhaps spending our resources there would be best for the people of the state of Ohio. The other thing I would throw out there is, the idea of like a social bond or some type of mechanism that we can get some of these corporate charitable dollars and some of these corporations into this mix. I think might be something where, the state of Ohio doesn't have to necessarily foot the bill if we're going to do research or a study, that we can get some of these corporations involved in the effort. I think is a worthwhile venture. I don't know if that would require legislation to do something like that or not, but I definitely think it would make a lot of sense for us to be looking at, what resources are already available in the community that people are willing to put forth to kind of further study these issues. So with that, I'll turn it back to you. Thank you.
And thank you so much for that, Joe. I know we're going into our last 10 minutes of the conversation, so really want to leave a room for Senator Wilson and Representative Creech, as well as Leanne, to chime in before we wrap up. So Senator Wilson. And he might be traveling, so, and Representative Creech, do you have any thoughts?
I don't have anything else to add at this time.
Thank you. And so, Leanne, your thoughts?
Honestly, I don't have a lot to add to that either. I think that I agree with the studies, and trying to get a handle on the need and the numbers. It kind of goes back to what I said for unpaid caregivers, just trying to have some kind of collective database to see just what's out there, what's needed. Other than that, I don't think I really have a lot additional comments to add at this time either.
Okay, thank you for that. So what I will say is, in hearing our conversation, I am definitely there with Joe. It's like, we don't have the luxury to be like, oh, we're about to do this 10-year study. We really need to, I guess, even really see what opportunities are there to make a meaningful analysis that can contribute to, I would say, the life and the wellness of current Alzheimer's and dementia, Ohioans, and just the supports that are needed. I also think about just the research in how do we attract people just in this field, from the wide spectrum, whether it's your actual practitioners, administrators, or nurses and paid caregivers. What does that actually look like when we know the trajectory of our state in terms of population, and are there some things that we could do to better increase our capacity as a state to have people that are focused and prepared as it relates to their career. I don't know if there's some opportunities that there's research out there that can kind of guide our actions and activities and investments to really build up our support. And if there's some things that you can do, whether early on or career transitions, I think that could be a benefit here in Ohio. And yeah, I know we've just, we've done a lot of different talking on the different issues. So I really wanted to add that to the conversation. As I indicated, we are coming to the end of our time. And it does seem that have we gotten through our entire list of discussion points, or are there any remaining? Does anyone know?
Representative House, there are a few more discussion points left remaining. If I'm looking at the document correctly, but I could be looking at it wrong.
No, you probably are. So what are those final discussion points so we can make sure that is on our list for homework and then scheduling our next meeting for, I'm assuming, next Tuesday and go from there. So Sally.
So if I look at our table that was put together, it looks like so some of them were in red. So, but I'm thinking maybe we were still to discuss those. So it looks we need 24, 25, 26, and 27. So it's 24 is promoting activities to maintain and improve brain health. 25 is improving the collection of data and information related to Alzheimer's disease and related dementias and their public health burden. 26 is improving public safety and addressing the safety needs related of those with Alzheimer's disease and dementia. 27 is addressing legal protections, and 28 is improving ways in which the government evaluates and adopts policies to assist individuals diagnosed with Alzheimer's disease and dementia.
I think the red ones were the ones that we had removed from our list, and they went to other committees.
I think that also, Pete. That's what I had down. Red were deletions and greens were additions.
Green were adds. Yeah, exactly.
Yeah, I had that same thing. That I had number 28 still on there for us, but I don't know if that's.
I thought that's what we were just discussing. Weren't we just talking about 28?
No, we were talking about 20.
Oh, 22. Okay, my bad.
But you're right. 28 is still out there. That just had a blue.
Okay, so based on the greens, what do we have and so if we can put that on the note.
My list, I believe the only one we have left is 28.
28.
Okay.
Governmental policies.
Okay, so
Chairwoman, this is Senator Wilson. I had to take a call from Senate leadership on the budget, fighting for my amendments to get us all more money. And so I've been off for a while, but I'm back on now.
Thank you so much, Senator. We appreciate it. So for the purposes, we say point number 28, we can circle back just for some point of clarity to see if those red ones were truly assigned to other committees or if there's some other work that we need to do. And I can circle back via email later on today to clarify that. But with that being said, I know we have to just do some things as far as our facilitator and our note taker. So if we can get some people to chime in for that and set our meeting date, the day, and this Tuesday will be yours.
Well, actually, if I may, Representative.
So if we continue go ahead, Alex. Sorry.
For this Monday's full task force meeting, it's my understanding that the draft version of the agenda will include the opportunity for the committees to meet. And so approximately the first hour will cover full related task force business. And then the second hour that is scheduled would be an opportunity for the committees to break out and continue their work. The director did indicate that she would like for the committees to utilize that time, realizing that the bulk of the work occurring at this time is within the committees, and she doesn't want to hinder that. And so there's certainly an opportunity to meet Monday for the second half of the full task force meeting. I see there being no issue with us continuing our work into Tuesday, but at the very least wanted to make that known that as the draft currently stands, there will be an opportunity for this committee and the other two to meet on Monday.
How does that sound to everyone here on the call regarding Monday?
What time is the meeting on Monday? I don't have it on my calendar.
Meeting is at 10 a.m. scheduled from 10 to 12.
Okay. All right. Thank you. I have a conflict at 10, but I think I can probably get out of that and have someone else cover it. Thanks.
Any other thoughts?
Well, I think sorry. I think so much of what we're wanting to do hinges a lot on our working with the consultant, or at least consulting with them on what things we want them to do. I'd say if we can use the last hour of the Monday full meeting, that could take the place of our Tuesday morning meeting next week.
I concur. Sounds good to me. So in that, I guess there are three things we need to do. We need probably someone to give an update for our meeting, the meetings that we have had since our last full task force meeting. And we also will need somebody to facilitate when we go into the breakout. And then also a note keeper. Unfortunately, I know I will not be available as it seems right now, Monday, due to another commitment and discussion I have to be in. But is there anyone else that may be able to chime in and help out?
I can facilitate.
I will take notes.
The second meeting.
Oh, there you go. Sally and Jean, woo, back together again.
And
the second half of the meeting, right?
Yes.
Yeah. Alex, do we need to give a report? Do you know, is that on the agenda?
As the draft stands, that is tentative. We thought that it would be appropriate to again allow the leaders of the committee to at least share what's happening to the benefit of the others as well. And so right now there's maybe like 10 to 15 minutes dedicated for the committee leaders to address the work that has occurred since the last regular meeting to everyone's collective benefit.
Okay.
So I vote Sally, you did such a nice job with that at the last general committee meeting. I think you would do great to give that report again.
I would be happy to defer to one of our committee members.
I second the
I'd be happy
nomination
to
and move that nominations
defer to someone else.
We cast the unanimous ballot for Sally.
Okay. So
Perfect.
just for a little bit of clarification quick before we all adjourn, I just want to make sure I have this right. We're just going to meet when we do the breakout sessions on Monday. That'll be our meeting. So we will not be meeting next Tuesday morning.
That is correct.
And we're just down to one discussion point, which is number 28.
That is correct as it is. I'm going to circle back just to check, but that is where we are.
And I've got Jean taking notes, Sally facilitating, and then Sally also giving the capacity committee report at the meeting on Monday, if needed.
Yes, that is correct.
Thank you.
You're more than welcome. So it is now 9:02. I want to thank everybody for taking time out of their day to contribute to our capacity committee meeting, and look forward. Hopefully everyone has an enjoyable week, and looking forward to touching base with everyone next Monday at our larger task force meeting. Everyone have a blessed day and enjoy some sunshine.
Have a good day too.
Thank
Bye.
you.
Thank you.
Thank you.
Bye, everybody.